After diagnosing your patient well, you also have to assess how fast the patient needs the healing also. Like in HIFU, where we use ultrasound, you also have a vaginal tightening probe, and we also get a vaginal tightening probe even in CO2 fractional. Now CO2 fractional is ablative and can be painful. Compared to that, HIFU is less painful and has a lower healing and downtime, and is also less painful than CO2 fractional. So according to the patient needs also, you have to choose your laser well. After choosing your laser, you have to go, you already have taken a medical history, so you have to see the contraindications of using a laser. Where is the end point of using the laser, and what is the post-op care for using the laser, so that you can use the laser safely on the patient. Now, as we have learned, there are two types of laser which are ablative, and the other is a non-ablative. Now, ablative lasers sacrifices the epidermis layer, so a newer modified collagen and a newer skin resurfaces with lesser wrinkles and lesser pigmentation, whereas in non-ablative lasers we keep the epidermis intact and we are remodeling the collagen by the wave which is emitted by the laser. So some examples, as I have told you, of ablative laser is CO2 fractional, erbium YAG and Nd:YAG. And non-ablative lasers is IPL. Also there are radio frequency machines which is transmitting radio frequency waves, like RF machine, and HIFU machine, which is high intensity frequency ultrasound. So let us learn about the contraindications about when to use the lasers. So the contraindications are bleeding disorders or patients who are on medical thinning medicines, which is warfarin and aspirin, keloids or hypertrophic scars. If you are using any ablative lasers, this might aggravate. Scar tissues, again the same reason. Epilepsy, which might be triggered due to the flashes which the laser emit while giving a shot. Pregnancy, you can induce contractions. Patient might react to the flashes and she might go through uterus contractions. Pustular or cystic acne, which is infectious and can spread if there is damage to the epidermis. Use of Retino A within last 6 months, because vitamin A is making the skin sensitive, so it might cause pigmentation and overreaction to the laser treatment. Uncontrolled diabetes, so because if there's infection or there is any cut on the skin, then during the laser it might not heal properly. If there is hypopigmentation or vitiligo, lasers itself sometimes alters the melanin reproduction, so there can be more hyperpigmentation or hypopigmentation. Open cuts or wounds, which might lead to infection. Skin that displays symptoms and infections of herpes, scabies or fungal. This is contraindicated absolutely, because in skin infections we are not treating the patient, it might spread. Recent major operation. Patient might be on medications which is not indicated during laser treatment. Bruises or mottled skin. severe Raynaud's disease, skin that has been exposed to UV light or which is freshly tanned skin. This might cause laser burns. Tattoos, because that will absorb more laser light than the surrounding skin and might cause burn. Raised pigmented moles or lesions, same reason. Pigmented birthmark, again the same reason. And persons below years 18 age. Again, severe cardiovascular diseases and pacemakers. Patient suffering from flu or untreated skin cancer, and rosacea type 3 and above. We have learned what rosacea is. So these are the contraindications, but how do we check what type of skin is suitable? This is the medical contraindication. Now, skin type with phototype 3 to 5 which are more darker skins, must have a small patch test done, treated before doing a laser, because they are more prone to burns. 1 to 3 type respond well to lasers. Now, which area you are treating? So the patch area and the shots, number of shots will depend on that. So if you are treating the skin, treat it below the neck and give a number of shots with pulse duration of at least 1 millisecond. A client must wait for at least 24 hours to see if there is any reaction to the shots, there are any burns or any adverse skin reaction, and then go for the laser treatment. Adverse skin reaction which you might see after 24 hours might include blistering, excessive erythema or swelling, scabbing or grey or darker color of the skin, and sometimes bruising. If a client has not had any laser treatment within the last 6 months, then you can again resuggest the patch test. And if the following contraindications are also there, you should handle the patient sensitively. What are the post-treatment care that you give to the patient after doing a laser treatment? So immediately after the treatment, the skin must be cleaned of all the gels and the pencil marks. So usually I ask the patient to apply a local anesthetic gel before going through the laser treatment. That will give a lesser discomfort to the patient because of the local anesthesia. As lasers all emitting heat along with the light, it's going to heat up the area, so it will give a little discomfort while treating the patient, and they'll feel its burning sensation. When the patient comes to me, I advise them to use a local anesthetic gel half an hour before going through the treatment. And we sometimes even do pencil marks to demarcate the treatment area. So you have to clean those gels and pencil marks and apply a soothing gel, which might be an aloe vera gel. I also give a cold fermentation application before treating the patient for laser, especially CO2 fractional and IPL. Dione might not need local anesthetic gel and a cold compress because it has a cold tip which is very comfortable to the patient and it is not going to burn the skin. All clients, even going through HIFU, need to apply a stronger and potent local anesthetic cream 40 minutes before going through the procedure. So when the clients receive all, you see that when the client come to you, they receive all the information and what post-op care they have to do in a leaflet form. Related to the skin rejuvenation and post-procedure home care. You also tell them verbally, but also give them a leaflet in case they forget it. For 72 hours post procedure, there should be no sun exposure at all because the skin is already turn sensitive to treatment. The client completely has to wear a total sunblock at all times and should use a hat or a scarf to cover the treatment area. Best is they stay indoors. They should not have a warm bath for up to 72 hours post treatment because again it will cause discomfort and burning sensation. They can use lukewarm water or bit cold water to shower for up to 72 hours post treatment. No scrubbing of the area, no rubbing, no swimming, steam, sauna, or vigorous exercise or any activity that will make them sweat for up to 42 hours to 48 hours to 72 hours post treatment. So soothing gels and agents can be applied to the treated area, but no products containing AHA to the skin post 72 hours, that is alpha hydroxyl acids. If the client does not have any soothing products or at home, advise client to return for the next treatment 3 weeks further, that is after 21 days, which is I have told is the cell turnover period. Recognition of the treatment related problems and adverse reactions. How do we understand if the skin is giving problems or adverse reaction? You record whatever changes are happening and you can use it as a database for further treatments. So if there is skin color changing to gray or a darker shade, if there is a blistering or bubbling of the skin, there's excessive discomfort expressed by the patient, they'll complain of too much heat or too much warmth from the IPL or any other machine that you're using and which is becoming unbearable for the client. They'll say it's a bit too hot or it's burning. So you reduce the settings accordingly. Erythema appearing on the skin in the shape of the laser shot. There is excessive bruising or swelling or edema. Understand the endpoints. There might be popping sounds, so lower the settings. Moderate erythema will be there, redness will be there. Moderate swelling and edema. There will be bruising and disappearance of dilated veins or capillaries. There can be darkening of the pigmented patches and spots. These are the endpoints. So don't go beyond this endpoints. Don't overdo the treatment and don't increase the settings beyond this. After the treatment, from 1 to several days, the adverse reaction can include. The adverse reaction need not necessarily come within 24 hours, but can also come after maybe 48 to 72 hours, which can be blistering, scabbing. There can be hyperpigmentation and hypopigmentation. There can be infection, increase in, like some people after doing a CO2 fractional laser, increase in acne, excessive and prolonged swelling, and sometimes scarring. Hypopigmentation can occur due to the destruction of the melanin due to your laser shots. If it is not, this is mostly of a dermatology concern, and you can send the client to a dermatologist, or a camouflage can be recommended if it is very mild. Sometimes it comes back to normal after a period of time. Now, hyperpigmentation can also occur, which can cause uneven skin tones and dark spots. Now this, because of the laser shots, melanin can get hyperactive and cause increased production of melanin. This can also occur due to sun exposure or heat or hormones or friction of the skin. Now let us understand what are the different types of hyperpigmentation. So you can see melasma, which is due to hormonal imbalance, and this is mostly a permanent condition which is aggravated in winters and due due to hormonal changes. It is rarely treated satisfactorily. Lighter pigments which are deeper will take longer time to treat. Age spots or liver spots which are superficial are easy to treat. Sun damages, which is mostly superficial, can be easily treated and responded. These are all different types of hyperpigmentation which you might come across. Post-inflammatory hyperpigmentation, which is light in color or deep in the dermis, take little more time to heal and many times get darker as it lives. Always use pigment suppression and sun protector with the treatments. Photosensitivity, this is another cause of hyperpigmentation which might be caused due to medicines or perfumes or chemicals. You must have observed patients or clients using perfumes directly or deodorants directly on the skin. The part of the skin turns very dark. Now perfumes contains chemicals which harm the layer on the cells in the skin and causes more pigmentation. Solar lentigis, which is sunspot, dark freckles, they appear due to the sun exposure.